Good morning. So I am going to be talking a little bit about yielding products for policymakers. And I'm going to do this in a slightly different way because I'm a storyteller, and I've always been drawn to the power of stories to both empower, dignify, and sometimes malign. And so I'm going to start this conversation with a story of how I came to be interested in blending these two worlds of policy, research, and practice. Well, three worlds, I would say. So when I was a very young girl, my grandfather passed away. My grandfather was a single father, and he was also a Korean War veteran, and he also had a really complicated history with exposure to discrimination. And those experiences that he had, I think, contributed greatly to his premature passing. My grandfather passed away around the age of 51. And the challenge with his passing was that it left both an intergenerational void in my family, but it also meant that my sisters and nephews and nieces never got to connect to our families in Alabama because he left in the middle of the night to escape a potential lynching. So these family stories, the narratives of his life, kind of served as a backdrop for my interest in the work on the health and well-being of boys and men of color. And so I came to this work with that fire in my belly. And then I went to Michigan and I sat in my first theory course, and I was warned about the dangers of me search, right? That like somehow if you made your work about yourself, that you would slip, away from this gold standard of objectivity. And it just didn't sit well with me. And I didn't realize it at the time, but what I was really desiring to do was to do work that was personally meaningful and relevant, and that I could actually, that wasn't so esoteric that folks wouldn't get, what it was I was trying to accomplish. And I think that approach has helped me in many ways in my work with engaging policymakers. So I did something really risky on the tenure track, and that was to apply for and then to pursue a White House fellowship. And that move, like many of my nonlinear moves, were all a desire for me to sort of get back to the roots of making the work that I do relevant to people that I really care about. And so I had the great fortune of having an opportunity to go to work for Secretary Leon Panetta and to serve as his special advisor on military mental health. And at the time, I didn't kind of connect the dots, but at the end, what I realized was that this was really all about my grandfather's legacy. He was a veteran. He suffered from many of the things, I think, in silence that I was charged with having to fix when I went to the Pentagon. So it was a really interesting space to be in. The floors at the Pentagon were not designed for heels. I think they did not intend for anything but boots to be on those floors. I was also, a solo status individual in many ways. I was a woman, I was non-military, I was a woman of color. And for many of the initial meetings at the Pentagon, I sat pretty mute. I mean, I was sort of shaken by it all, and I didn't know really how to engage folks at the level that I thought they needed me to engage them. And so a really interesting thing happened to me one day. I'm walking down the hall, and there was like four brass, coming towards me. And in that moment, I thought, okay, I should probably say hello. I'm walking, these are 4 stars. I probably should say hello. And I opened my mouth, and this voice came out that like literally sounded something like Michael Jackson, like before all the changes. I mean, I was like, whose voice is that? And I realized that part of what it was going to take for me to be successful in this work was to find my own voice. And so I would say that policymakers, in my experience, and this is a limited scope, but I'll share with you that what I learned is that the most compelling policies get made anecdotally. And if you have a voice, that you have to use it in those spaces and not shrink back. And it sounds like a very simple thing to do, but in many instances, we are trained as scientists to be precise. I mean, we are empiricists. We think we cannot make a policy recommendation, so we have done 15,000 studies, to prove a point. And actually, in policymaking circles, my experience has been that the loudest voice at the table is the person who's had a single experience for which they think should guide all the policy in the room. And they will often get the ear of policy decision makers because they are confident about what they have to say. So I think the first advice I would give about engaging work in this space is to be bold. And you can also engage the policymaking process across the continuum. We often think that policymaking is about making a change or implementing a policy, but actually there's a lot of stuff that happens along that continuum first. Setting the agenda, legitimizing a policy, which we are all equipped to do. And so I've been very thoughtful about that since returning. So coming back from DC, one of the biggest challenges for me in reintegrating in my department was helping them to see how this all fit together. And also helping them to see that it wasn't just service, right? This isn't just service. This is actually a part of the process. Was challenging. I was really unprepared for having that sense of like you were off, sort of gallivanting around the country and the world with the SecDef, and what does this have to do with your career? So I had to actually make it a case for it. But it also made me come back with this idea that whenever there was an open policy window, as Senator Kennedy, reminds us, I had to be ready to walk through it. So something really remarkable happened. President Obama launched the My Brother's Keeper initiative. And I knew from my experience in DC that those windows open so rarely and they close so quickly that you have to be poised and ready to walk through them. So I would say that the other thing that, in addition to being ready to walk through the open window, is to think about what kind of policy products can you contribute. So we have been working on a series of policy briefs, but we have also been working on local legislation to improve the health and well-being of boys and men of color in spaces that wouldn't have actually traditionally thought about it as such. So working with the workforce development community to think about the economic imperative of having a workforce that's dying prematurely. I mean, we're a browning nation, we're in the most significant demographic transition of our time. And if we don't pay attention to the health and well-being of boys and men of color, then we're gonna lose a significant portion of our workforce. So helping them to see that this is not just about boys and men of color. This is about the women and children that they leave behind, like women like my mother and my sisters, and all of the women who lose men prematurely from conditions that are preventable. So am I out of time? Okay, I have 34 seconds. So I will say that I'm happy to talk with folks about how to do that at the local level. We are now engaging with folks within Durham County who have taken up My Brother's Keeper initiative as a part of their charge, and health was not a part of that. Like the My Brother's Keeper initiative was focused on education, and I said, no, actually we cannot just improve education for boys and men of color. They have to be healthy. They have to have social emotional competence. They have to, be aware of the hidden traumas that affect their capacity to learn. And in some ways, having that platform, even though it was an imperfect policy platform, created an opportunity for me. So I would also say seek out those opportunities that even don't seem as readily apparent opportunities to improve the population health of individuals that you care about. Thank you. Thank you.